Afternoon. I would like to welcome everyone to today's webinar, where we begin to talk about the National Medicare Equality petition and the direction that we are headed with the American Chiropractic Association. First of all, I'd like to cover a couple of bases so that everyone knows how today is going to work. Primarily, we are going to be listening and participating with John Filardo with the American Chiropractic Association. He's the Senior Vice President of Public Policy and Advocacy, and he's going to be talking to us about the National Medicare Equality Petition. In essence, this is a project that we have been talking about and pushing towards and positioning for many years, and we're beginning that process with a concerted effort currently with the ACA. If you have questions throughout today's broadcast, please use the question bar on the right-hand side. And what we'll do is we'll wrap up the primary portion of today's webinar, and then we will close out with questions towards the end, just before we wrap everything together. So if you would, just on the right-hand side, you'll see the question box. Type in your questions. You can type those in at any time or even during the Q&A period at the end of the session. So we do not continue an introduction. Let's go ahead and get started. John, why don't you go ahead and take over.
Thank you, Mark, and thank you for joining us here today. And I also thank the Illinois Chiropractic Society Board for becoming involved in supporting in this effort. As you see on your screen right now, I'm going to walk through a presentation, a PowerPoint presentation, and let you become familiar with this campaign, and more importantly, how you can participate. That will be I think, as you saw on the agenda, that's two separate items, but I think I'll combine them into one, and we'll go from there. What is the campaign? That's the first question I get from a lot of folks, and this is again a grassroots campaign to achieve full physician status for doctors of chiropractic, and most importantly, chiropractic patients in Medicare. As you know, I don't have to tell you on this call, but the benefit, the chiropractic benefit in Medicare is right now is very limited, and it's been that way since 1972. So this is we have been working with HHS for many years to rectify this limited statute, and to work the regulatory end to make sure that you can perform Medicare covered services that are under your state scope of practice. So what we're doing now, we're still working with the administration, but we're running a dual track campaign, if you will. One on the regulatory end via HHS, and then one on the legislative end via the Congress. And this is the most significant action that we have taken on Medicare in quite some time, especially since the demonstration project, which ended about 8 years ago. Again, this is something that we at ACA believe is vital. In fact, back in February, our House of Delegates voted this to be the top legislative priority for the association going forward. And how does the petition work? Well, as many of you know, with Congress and even in your state legislature, it's a numbers game. We want to create more numbers of support for any legislative initiative that we do, and for this one, it's really going to be vital to have our patients, our family, and friends involved in this process. We can't do it alone. with just doctors and us here at ACA and your leadership in Illinois. So it's going to take more folks to help push this across the finish line. And so what we're asking is doctors and patients and friends and family, again, to sign on to what we're calling the National Medicare Equality Petition and help raise awareness of this issue. I have spoke to many members of Congress in the last year, and I'll be honest with you, not many of them knew that the benefit for Medicare patients in chiropractic is limited, and some of them are even surprised to find out that it's limited in nature or in statute. And so what we are trying to do is raise awareness through a grassroots campaign, and from there we will have a database that we can unleash on the Congress when the time is right. But right now we're asking folks to sign this petition so we can get some vital information, and most notably their name, of course, their name, email address, and zip code, so we can target folks by congressional districts. Now, those who sign the petition will be sent, again, as I said before, action alerts and in a Chiro Health newsletter that we put out on a monthly basis. And if you are aware of the former Chiro Voice grassroots campaign that was used primarily during healthcare reform, those folks get these newsletters as well. And what these folks will urge them to participate in grassroots campaign, primarily on Medicare. And that's the big difference here between the National Medicare Equality Petition and Chiro Voice. Chiro Voice was developed, about 6 years ago to basically get folks involved in healthcare reform, the general healthcare reform issue. During that time, we had over 100,000 messages sent to Congress using the Chiro Voice database, and that was good. But I think in this instance, we're going to need many more than that, and that is why this campaign is focused. It's focused on one issue, and that's Medicare. And again, as you see on your screen here, is to create a groundswell support that Congress cannot simply ignore. And again, we'll be working primarily with many folks on the Ways and Means Committee in the House and the Finance Committee in the Senate, but all members of Congress at some point will be contacted via this petition. Well, why now? As I said before, the ACA House of Delegates passed the resolution making Medicare parity a priority going forward. And again, the chiropractic benefit realistically hasn't been changed much since 1972. The latest change was that in 1997, the X-ray requirement was removed. And but even since then, and with the demonstration largely showing that providing these covered services was largely budget neutral, and despite our lobbying with the administration for regulatory relief, the administration just hasn't been convinced that having doctors of chiropractic perform at full scope is in accordance with the statute, with alliance with the statute. So what we have to do is change the statute, and the only way we can do that is through congressional action. And of course, you look at the demographics. The baby boomer generation is growing. The number of people that will be reaching Medicare age is going to increase by 1/3 just over the next 10 years. And right now, Medicare serves 55 million beneficiaries. However, I can tell you, along with that number, that's only 2 million of that 55 million access to doctor of chiropractic. And of course, you can look at many different reasons why that is, but the primary reason is that the benefit is limited, and many patients have to eat the cost of additional services, which are Medicare covered services. Now, as I've told folks in Congress, we're not looking for any new benefit. What we're looking for is that if a service is covered in Medicare and is under a doctor of chiropractic state scope of practice, that doctor should be able to serve that beneficiary and then, of course, be reimbursed for that. And we've always heard, as Medicare goes private insurance. So we are hoping that as we work for further integration in Medicare, this will help us on the private insurance front as well. So what we have done, again, going back to the petition, is asking patients and supporters to sign it online. It's very easy to do. You see the website up there, acatoday.org/equality. That brings you right up to the site, and a patient, a doctor, a friend or family can sign up right there, right on the site. I've heard from many that I've got patients that don't have email addresses or anything like that, or anything they can do to become active and to participate in this campaign. And the answer there is yes. If you go acatoday.org/equality/doctors, you'll see a paper format is there as well. It's a little bit more complex because when a patient signs up via paper, HIPAA rules come in, but it's still very easy to do, and you can mail them or fax it back to us here at ACA, and we'll put those folks in the system. I've heard from many doctors and asked, what they're doing, to get their folks involved. Many of them are simply just putting a laptop or an iPad in their waiting area or in the clinic, and having patients sign in at check-in or things like that. I went down and visited with our Virginia delegate here in the Washington area just last week, and he's got an iPad set up right at his clinic, and he's urging folks to sign up right there at the in his office. And all of this again is all the background information and everything is at that website /equality/doctors. You walk you through what you can do in your office in order to participate. I think tomorrow also, that's not on here, but tomorrow we're going to come out with what they call a widget, and that's something that you can stick right on your clinic's web page, and you can put it on the Illinois Chiropractic Society web page, and there folks can click on that, and it takes them right to the sign-up page. So we'll have that out tomorrow, and so you can even put that on your own clinic's web page if you want, and have folks sign up that way as well. We're also one of the neat things that we didn't have back in 2009 when we launched the Chiro Voice program was this whole social media, Facebook and Twitter and so forth, and we have a Facebook page signed up on this, created rather, and it's facebook.com/Medicare Equality. You can go on there for further information as well. Twitter and Instagram, it's a hashtag Medicare Equality. Again, this is something that we didn't have in 2009, and we're already seeing the benefits of this We've got, I think, almost 1,000 likes on our Facebook page, and it's something that, again, that can help raise awareness and most of all, raise visibility for this campaign. It's something, again, that we're really excited about, is the whole social media component as well. And if you're on Facebook and in Twitter, you can also, of course, forward this information on to folks that you're involved in on those sites. So again, this is something. Again, we have graphics. Oh, I'm going to go back one. We have graphics and so forth on social media. You'll see that on our web page. We have all of that good stuff. And I'm just going to get this little window. Okay, this is again, share our resources and links and graphics on social media. We have, again, all of that on the doctor's page that you can access and have that ready on social media. This is going to be an ongoing campaign. I expect this to last at least through calendar year 2016, maybe even into 2017. Again, we're asking you to collect these names and share via social media and get the word out, until we stop this thing, and I don't see that happening, in the real near future. So again, this is going to be something that is ongoing. I can't tell you right now, when we're going to have a bill in the hopper or anything like that. We're not at that stage yet. We're talking to many senior members on the committees of jurisdiction, but we haven't gotten to the point where we have actually a bill that will correct the statute in play yet. Once that happens, all of this will be ramped up even more. But right now we're in the relatively beginning stages of this, planting the seeds with members of Congress and getting folks on board on this grassroots campaign. All right, I'm going to stop right there on this and talk on another subject, and that is our key contact program. And I guess after that is done is when we'll take questions. And but I just want to talk to you a little bit about key contacts. Now, key contacts are folks that have a personal relationship, if you will, with a member of Congress or a senator, that we can call upon those people if we need a special message, targeted message sent to them, and so they can help us get the word out. As you can see, as I have on the screen right now, this is the Illinois key contact list. We've got most of Illinois filled, which is pretty good. You guys are ahead of most states. But as you can see up there near the top, for Congressman Bobby Rush, Robin Kelly, Luis Gutierrez, Janet Schakowsky, Bill Foster, Adam Kingsinger down at the bottom, and of course Darren LaHood, who is relatively new. The ones you see in yellow are freshmen. So those are the folks that we need or key contacts for. So if anybody on this call knows those folks, is pretty good with them, either they're a neighbor down the street, have attended a fundraiser, knows them by name, knows you by name, have played golf with, anything like that, that's a key contact. And so we'd like to fill this board up. And if anyone on this call is a key contact to anyone, any of these blanks on this list, or in addition that can help with the other ones listed here, please let Mark know, and then Mark can forward that information on to me. And once we need these key contacts, of course they'll be they'll be notified. Mark, that's all I have. If you want to open up for questions, we can go from there.
As I mentioned earlier, you can actually access the questions on the right-hand side. Bear with me here just one moment. John, here's a couple of questions that we have had presented at this stage. Can any age patient sign the petition, or do you just want your Medicare patients to sign?
Good question, and one I've gotten a couple times. And anyone, I would say anyone of voting age can sign this, because we all know someone who is a senior citizen, someone who may be on Medicare, parents, aunts, uncles, grandparents, so forth. But anyone can sign this petition. Anyone, I would say anyone over the age of 18 can sign the petition, but that's a good question, and it's one I've gotten a couple times, and yes, we'd like it. Anybody can get in the pool here.
Okay, I've posted the names of the Illinois congresspersons that we need to identify key contacts for. Hopefully everyone can see that. One of the other questions that was brought up was from one of our doctors that asked the question in regards to the demonstration project, that some of our doctors are under the standing that the demonstration project did not necessarily shine a favorable light on chiropractic.
Yeah, there were some areas that didn't. But for the most part, in most of the demonstration areas, as I said before, there was some cost savings, or it was budget neutral. That is something that we can. I'm sure we'll be asked once we actively seek a bill or a sponsor for this issue. But I think there is. I don't think that will be as great as an impediment to moving this issue forward. I think there was enough good data that came out of the demonstration. Again, there was some that was less than favorable, but I think there was enough good data there that folks in Congress can see that this was a worthwhile demonstration project.
Okay, thank you. And another question that we have, there is one doctor who is concerned about potentially if we do expand, if we do create equality where doctors are being reimbursed what other physicians or other providers are already being reimbursed for those services, would that create a potential issue with limitation on reimbursement amounts? In other words, would it more closely resemble the Medicaid payment model, or would it? What would that look like potentially? And I know we don't have language at this stage, but what do you foresee?
Yeah, that's a good question as well. And basically, what we want to see is to be on par with as you said, Mark, other providers in Medicare. We're the only ones that have this type of limitation. Only physician-level provider that has this type of limitation, and it's simply this model for over 40 years just hasn't worked, and it hasn't worked for the most part in the especially for patients and for doctors of chiropractic. It's just as far as limited reimbursement, it would be on the same par. Let's say for an example, an E&M code. we think that E&M code, I can't say right now. I think that's getting a little ahead of ourselves what it would look like, but at least it would be there. Right now, as you know, there are no E&M codes in Medicare that DCs can be reimbursed for, and so it's all of that, X-rays, post-therapy services, any of that. Right now, you can't be reimbursed for, but there will be reimbursement for those codes in some form once this statute is changed. That's the first thing that has to happen. The statute has to be changed, and then we can work with CMS about certain codes and all of that. That will come. But it's the statute that's gotten in the way of everything, especially in the last 6 years when we started with Kathleen, then Secretary Kathleen Sebelius, and tried to work this through the regulatory angle. But they've just pointed back to the statute all the time. But I know that's long short answer long, but I think in the end this will be nothing but a win-win for doctors of chiropractic and patients.
Yeah, actually, we agree completely, John. So another question that we've got, somebody who's asking, are you originally going to focus just on the examination and X-rays, or are you looking to spread that out to full scope inclusion if it's already being covered for another provider, that you would cover that, which would include physical therapy, and things along those lines?
Sure, no, not just limited to E&M. This would allow you to bill and be reimbursed for any Medicare covered service that is under your state scope of practice.
Perfect. So another question just came across. In relation to what we affectionately call 2706, with a non-discrimination clause within the Affordable Care Act, isn't this already covered in that language? Why do we have to jump through these hoops if it's already in federal law?
Yes, unfortunately 2706 does not apply to Medicare and Medicaid, and it only applies to plans that are covered under the public health service, which means mostly private plans in the exchanges, and ERISA plans. But Medicare and Medicaid fall under the Social Security Act, whereas everything else falls under the Public Health Service Act. So it's two separate entities. And 2706, unfortunately, does not apply to Medicare. And we believe that changing the statute to bring it more in line to the 21st century would serve as a sort of non-discrimination language.
Okay. I believe that at this stage, that is all the questions that we have. Actually, another question just popped through. I'll just go ahead and throw this in there. The question is, will this also include Medicaid for Illinois? I'll go ahead and address that one, John. It's a different project. Those are two different projects, although they both contain federal funding components. This particular provision within Medicare would be different than Medicaid. Much of the coverage for Medicaid is handled on a state-by-state basis, and in Illinois that is no different. And so that is a separate project of which we are working on at the Illinois Chiropractic Society, where we have sat down with the Department of Public Health, and we're meeting with a variety of the ACE entities across the state and talking to them about Medicaid coverage and their coverage of chiropractic and how it can benefit them inside of those particular HMO-style products, which is the direction that Medicaid is going in Illinois. Another question that just came through, John, is how will this affect the Medicare the Medicare replacement plans or the Advantage plans?
Yeah, this would apply to them as well. Again, this would allow for full scope in the Medicare Advantage plans, I believe. And just getting back to that last question on Medicaid, Mark, as you know, chiropractic it's a state option. While there are there are some providers, of course, that have been fighting for to make it mandatory, to make their service mandatory. I can tell you that during healthcare reform to podiatrists, their big issue was to make podiatry a mandated service in Medicaid, and unfortunately they didn't make it. And people have said to me, well, why don't you make, why don't we fight that fight as well? Well, that's the next one. That's the next fight. We've got to create a Medicare benefit that is fair to the providers, fair to doctors of chiropractic, fair to chiropractic patients, and once that is accomplished, then we can go for a mandated benefit in Medicare, because I don't think you want the limited current Medicare benefit right now as a mandated Medicaid item. So that's kind of a little cart meet horse exercise, is that we've got to get full scope in Medicare first, then we can work for a mandated benefit in Medicaid. Just want to add a little bit more to that, to your explanation as well.
No, that's perfect. I believe that's all the questions that we have at this stage. There's some questions that were here that were specific enough that we know that we don't have that information at this stage as to what some of this may look like on a day-to-day basis and regarding referrals and other things in some of the Medicare Advantage plans. So I don't know that we need to get into the weeds quite that far. So I'm not seeing any other questions at this stage. John, if you want to go ahead and wrap things up.
Well, again, thank you, Mark, and thank you to the Illinois Chiropractic Society for coming on today. And we are always available for any questions on this campaign. You can simply email equality, the word equality, at acatoday.org. That's our dedicated email address to this project. This is going to be a long, drawn-out fight, one that I am, to tell you the truth, I'm excited in doing. It's something that we here at ACA are very optimistic, but we're also going to need support at the state level and at the individual doctor level during this entire process. It's going to be a campaign that has never been seen, the likes of which have never been seen before. I'm excited about it. I think we can win this, and it's going to take some time and some patience. There will be fits and starts during this entire thing. I've been doing this now in some form or fashion on Capitol Hill for almost 31 years now, and I can tell you there are going to be some rough spots. But again, I'm very optimistic. I thank you. I welcome your support, and we need your support. And we'll be working with Mark and others going forward, your state leadership going forward, and I want to thank you again for attending today's call. And most of all, happy holidays to everyone out there.
Yeah, thank you again, John. For those who are watching, you can see actually the slide that gives you where the petition is again, the instructions specifically for the doctors, and then the email for questions is all up on your screen. You should be able to see that now. And again, John, we thank you. We thank you for the ACA's leadership and moving forward. You and I have been talking about this for a number of years, and the direction that we can go, and the Illinois Chiropractic Society looks forward to working with you and other national organizations that are pursuing the equality in Medicare. So thank you again, John, and happy holidays to all of our doctors that are on the call.
Thank you.